Hi and welcome back to another video of Medic Notes. This video will be on Parkinson's disease. For introduction, Parkinson's disease is the triad of tremor, hypertonia, and bradykinesia. For tremor, it is resting tremor where it is worse at rest, and there is a pure rolling tremor of the thumb over the fingers, look like they are rolling a pew. Hypertonia can look for cogwheel rigidity, which is tremor plus rigidity. This can be felt by the examiner during rapid pronation and supination of the patient's arm. And the third is bradykinesia, where the patient will be slow to initiate any movement. You will note slow actions, reduced blink rate, expressionless face, and if you ask them to walk, you may see a shuffling or festinant gait. This is the triad of Parkinson's disease. The cause of Parkinson's disease is due to the loss of dopaminergic neurons in the substantia nigra. There are also some other causes. According to studies, it could be due to genetic cause. And the mean age of onset is around 60 years old. So it happens more in elderly people. The symptoms include tremor, where there is shaking, usually beginning in the limbs, often in your hands or your fingers. Slowed movement, also known as bradykinesia. So over time, Parkinson's disease may slow down the patient's movement and making simple tasks to become difficult and time-consuming. The patient's steps will become shorter when they walk, and they may even find it difficult to get off a chair. Rigid muscles, impaired posture and balance. So some patients, when they present with a falling episode, one of the causes could be due to Parkinson's disease. Loss of autonomic movements, such as blinking, smiling, or swinging the arms when you walk. So in Parkinson's patients, you will note that there are reduced swinging of the arms when they walk. Speech changes, where they might appear monotone, and writing changes, because it may become hard to write and their writing will become small, which we call as micrographia. To diagnose Parkinson's disease, it is a clinical diagnosis based on the features of Parkinson's, such as the tremor, hypertonia, and bradykinesia. So far, there is no specific investigation to confirm Parkinson's disease. The treatment focuses on the symptom control, and it does not slow down the disease progression. Some of the pharmacological treatment include drugs like levodopa, dopa decarboxylase inhibitor like carbidopa, dopamine agonists, anticholinergics, MAO-B inhibitors, and COMT inhibitors. These are some of the Parkinson's disease drugs. So if you look at this picture over here, it shows an illustrative diagram of the mechanism of action of the different drugs. So that basically, overall, it is to increase the level of dopamine in the body. So you can see there are the MAO-B inhibitors such as selegiline and rasagiline, COMT inhibitors such as tolcapone, dopamine agonists like ropinirole and pramipexole, and at the lower side there is a dopa decarboxylase, which is carbidopa. Besides pharmacological treatment, there is also non-pharmacological treatment such as deep brain stimulation, where it may help those who are partly dopamine responsive, and also surgical ablation of overactive basal ganglia circuits. That's all for this video. Thank you.